Next presentation from Shatursunov family, Farrukh Makhamatov, surgical treatment of cervical intervertebral disc herniation using the method of endoscopic microdiscectomy. This presentation from Uzbekistan, Tashkent. You can start.
Oh, thank you. First of all, good afternoon, dear colleagues, respected chairman, and distinguished guests. My name is Farrukh, and today I want to say a big thank you for opportunity to be here. And today I would like to present our experience in surgical treatment of cervical interbody disc herniation using endoscopic microdiscectomy. Cervical disc herniation remains one of the most common causes of cervical radiculopathy and significantly affected patients' quality of life. During this presentation, I will discuss our indications, surgical techniques, and clinical outcomes. Cervical radiculopathy is a common condition caused by compression of the cervical nerve roots. Patients typically present with a neck pain, radiating arm pain, numbness, sensory disturbance, and sometimes motor weakness. The most common cause included disc herniation, foraminal stenosis, osteophyte formation, and hypertrophy of surrounding structures. These symptoms can significantly impair daily activities and reduce quality of life. Fortunately, many patients improve with conservative treatment. However, surgery becomes necessary when symptoms persist, neurological deficit progress, or pain becoming disabling. Today, we have several surgical options available, including SADF, cervical disc arthroplasty, posterior decompression techniques, and endoscopic surgery. Modern cervical spine surgery increasing requires pathology-oriented approach based on localization of this pathology, spinal alignment, neurological status, degree of neural compression, and of course cervical stability. Development in Uzbekistan over the last several years, minimal invasive spine surgery has developed rapidly in Uzbekistan. Since 2019, our center has been actively introducing cervical endoscopic procedures into clinical practice. At the same time, conventional SADF remains an important treatment option for more complex pathology. Growing surgical experience has allowed us to gradually expand indications for endoscopic treatment. SADF remains one of the most reliable and widely performed procedures in cervical spine surgery. It is especially useful in the patients with central disc herniation, several stenosis, myelopathy, and cervical instability. However, despite excellent outcomes, SADF is associated with a fusion of the operated segment and loss of motion at this level. Let me show two clinical cases with SADF. This is an example of patients with significant cervical neural compression. Preoperative MRI demonstrated several pathology requiring anterior compression. SADF was performed successfully with adequate decompression of neural structure. Next patient, this is a 29-year-old female patient with a C5, C6 disc herniation. These patients underwent SADF at the C5, C6 level using the unicorn cage. Post-operative image confirmed successful decompression and stabilization of the affected segment. All right. Now, endoscopic cervical spine surgery is rapidly expanding worldwide. Improvement in surgical equipment and visualization have significantly increased the safety and effectiveness of these procedures. As a result, more surgeons are adapting endoscopic techniques for selected cervical pathology. In our center, approximately 11 endoscopic cervical surgeries were performed in 2022, 28 in 2023, 32 cases in 2024, and approximately 35 procedures in 2025. Our experience with cervical endoscopic surgery has still increased over recent years. The number of the procedures performed annually continues to grow, and our surgical indications expand. The current study includes 106 patients treated using endoscopic cervical techniques until 2026. Clinical levels most frequently involved level was C5, C6, followed by C6, C7. This distribution is consistent with literature because these levels are exposed to the highest biomechanic stress level. Together, these two levels accounted for the majority of cases in our study. Now, we will talk about patient selection. The most frequently involved careful patient selection is one of the most important factors for successful endoscopic surgery. Before surgery, we elevate the localization of the disc herniation, neurological findings, spinal stability, and radiological characteristic. Proper patient selection significantly improved surgical outcomes. First of all, I'm gonna talk about patient indications for endoscopic spine surgery. In our practice, endoscopic surgery was mainly performed in patients with a lateral and foraminal soft disc herniation. These patients usually present with unilateral radicular symptoms and present cervical stability. In such a situation, endoscopic decompression provides excellent visualization and effective neural decompression while preserving motion. And endoscopic surgery is not suitable for all patients, unfortunately. Patients with severe central stenosis, calcified disc herniation, cervical instability, multi-level pathology, or ossification of the posterior longitudinal ligament are generally better candidates for alternative surgical procedures. Therefore, patient selection remains critical. Now we will talk about docking of the endoscopy. The first step is accurate localization of the target level under C-arm. The skin is marked approximately 1 cm laterally to the spinosus process. After a small incision, dilatation is performed. The working cannula is then carefully docking at this desired surgical target. And after, of course, V-point. The V-point is one of the most important anatomical landmark during posterior cervical endoscopic spine surgery. Identification of this landmark allowed safe orientation and help establish the working corridor. Proper recognition of the V-point is essential for avoiding unnecessary bone removal and maintain surgical safety. After identifying the V-point, limited bone resection is performed using the high-speed bore. Both superior and inferior lamina are partially resected to create an adequate working space. The goal is to achieve sufficient exposure while preserving spinal stability and minimizing damage to surrounding structures. At this stage, precise previous bone work is extremely important because of the limited space available in the cervical spine. In this slide, I performed video, but unfortunately, I did some mistakes. Therefore, my video is not working still. After adequate bone decompression, the superior and inferior borders of the ligamentum flavum becomes visible. The ligamentum is carefully detached and removed under direct endoscopic visualization. This step allowed access to the underlying neural structures and facilitates safe decompression. Participant attention must be paid to avoid injury to the dura and nerve roots. All right. Unfortunately, not working. Following complete removal of the ligamentum flavum, the neural elements become clearly visible. At this stage, we access the degree of compression and prepare the operative field for removal of the herniated disc material. Adequate visualization is one of the major advantages of spine surgery. All right. Once of the nerve roots has been identified, and protecting the herniated disc fragment is carefully exposed. The herniated material is removed using endoscopic instruments under direct visualization. The compression is considered complete when the nerve roots become freely mobile and no residual compression remains. This is a key therapeutic steps of the entire procedures. All right. This slide summarized the major surgical steps of the procedures. This systematic approach allows the safe and effective treatment of the lateral cervical disc herniations. Advantages of the cervical endoscopic surgery. Cervical endoscopic surgery offers several important advantages compared with the traditional open procedures. The technique requires only small incisions and caused by minimal damage to the paraspinal muscles. As a result, patients usually experience less postoperative pain, less blood loss, and faster recovery. And another important advantage is the preservation of the motion segment, which may reduce the risk of adjacent segment degeneration. In addition, endoscopic visualization provides excellent magnification and illumination of the surgical field. This benefit make endoscopic surgery an effective option for careful patient selections. All right, let me show you some clinical cases. This patient has a 48 years old male who presented with a neck pain radiating to the left upper extremity. MRI shows left side C5, C6 disc herniation, caused significant compression of the nerve roots. Conservative treatment, unfortunately, was unsuccessful, and surgical intervention was identified. Endoscopic decompression and removal of the herniated fragment were performed. Postoperative MRI demonstrated complete decompression of the neural structures and successful removal of the disc fragment. Okay, let me show next patient. This patient was a 43 years old female with a severe left side radicular pain. MRI demonstrated left side C6, C7 disc herniation with foraminal compression because symptoms persistent despite conservative treatment. Endoscopic decompression was performed. Postoperative MRI confirmed complete neural decompression while preserving the motion segment. The patients feels very good, and these patients has also disc herniation, but right side. You can see MRI preoperative and postoperative, and last patient also has a disc herniation left side. After removing disc herniation, we can see adequate decompression is confirmed by free mobilization of the neural structures. And our result demonstrated significant clinical improvement following surgery. Patients experienced reduced postoperative pain, early mobilization, and shorter hospitalization. Intraoperative blood loss was minimal due to invasive nature of the procedures. Overall, endoscopic surgery provides to be a safe and effective treatment option for appropriately selected patients. In conclusion, several endoscopic surgery is effective, minimally invasive techniques for the treatment of the selected cervical disc herniation. The procedures provides adequate neural decompression while preserving normal anatomical structures and motion segments. Proper patient selection remains the most important factor in achieve successful outcomes. Our experience demonstrated the endoscopic surgery is valuable additional to modern cervical spine surgery. And I would like to thank my teachers and mentors for their support, guidance, and inspiration. Thank you for your attention.
Okay, thank you very much.